While we've seen benefit for use of checkpoint inhibition in early triple negative breast cancer, we've all been quite curious to understand what the benefits of checkpoint inhibition are in ER positive disease. And so we have now seen data from two different trials, Keynote 756 as well as CheckMate 7FL, that looked at adding a checkpoint inhibitor to chemotherapy in the preoperative setting. Very importantly, though, these trials restricted to patients who had high-grade cancers. So it wasn't your typical ER-positive patient. It was a highly proliferative ER-positive tumor. And what we saw was that adding a checkpoint inhibitor to chemo did improve pathologic complete response rates in both of these trials, and that was statistically significant. We were getting PCR rates that were above 20%. I think the challenge, though, is in ER-positive disease, treatment paradigms are a little different than in triple negative cancers because patients do get very effective therapy post chemotherapy with endocrine treatment. And nowadays, we are even using CDK4/6 inhibitors, although that was not predominantly done at the time this trial was conducted. So I think we're all very curious to see what the event-free survival will be, particularly from Keynote 756, which was powered for EFS as a co-primary endpoint, to not just understand if the benefits from pembrolizumab in that preoperative setting not just improve PCR, but translate into EFS benefit, even in the setting of people who are getting effective adjuvant therapy after surgery. And then also, if there are going to be biomarkers that help us select which patients actually need checkpoint inhibition. There was some hint in the preoperative setting that maybe PD-L1, for example, could help us see which patients are deriving benefit, but I think we're going to need to see how those biomarkers correlate with EFS to better understand if the benefit is seen across all patients with high-grade cancers or whether it's in a specific subgroup. So I think much more to come, and definitely are very eagerly awaiting the event-free survival data.